going to a cervical screening follow-up appointment.
Some patients will need some more tests after their smear test. You will be invited for an appointment in a colposcopy clinic. 4 Act to go back to the doctor's surgery for another smear test, being called a colposcopy appointment or for another smear test just not always mean there if something's wrong. If you are invited to colposcopy, this is important that you come to the appointment. There are different types of letter that you might receive. Your smear test sample may not have been big enough. You may be invited back in 3 months to have another one. Do not be worried about it. This is normal and can happen. You may get a letter after you need to do another smear test in 12 months at your surgery. This will be because the smear tests have ticked up HPV. The letters HPV stand for human papilloma virus. If this is a common virus, it does not affect most people. Sometimes the HPV can make a cell in cervix go wrong. For a small number of people, for the cervix, HPV can cause cervical cancer. This is why this is important to get your HPV vaccine.
What happens if you need further tests?
You may receive a letter asking you to recome the clinic or hospital because the cells in your smear test were not normal. The team would like you to have some more tests. If you are that to go back to have another smear test at your doctor's surgery, you might want to watch the other video about this appointment again. If you're coming to the clinic or a hospital, you will receive a leaflet about your appointment. This video could help explain what will happen. Each clinic will be different. This video explains what happened on your visit. If you think you might need a longer appointment, you could let the hospital know by calling and remembering your letter. When you arrive at the clinic, which is normally in a hospital, we will check in at reception. This is normally a good idea, somebody with you to keep you company. Then you'll be called through into the clinic.
What will happen during your appointment?
In the clinic, there will be a colposcopy. This is normally a doctor or nurse. There may be a couple of other people with them, usually a nurse or a healthcare assistant. If you feel like there's too many people, please let the team know. The nurse will bring you into the clinic room. If you want, you can bring somebody with you. A doctor or nurse will have a chat with you about what will happen next and why you are there. It's fine if you ask questions or take time during your appointment. The team want to help make sure that you're comfortable as possible.
The doctor will ask you some questions such as, have any of your family had cancer? Do you have any bleeding between periods or after sexual intercourse? If you have periods, when was your last period? Is there any chance you could be pregnant? Do you have any medical conditions? What medicines do you take? This will help the team to make the right decisions for you.
What type of test will you have?
Sometimes you'll be asked to provide a sample of your wee, and the team will check your wee and do a pregnancy test. The doctor will then ask you if you can agree to an examination. They will explain what involves, and sometimes they may need to take a little sample to look at closely. If you'd like to go ahead, the nurse will show you where to get ready. They will ask you to undress your bottom half. They recommend you wear something easy to take off. They'll then help you to get settled on the chair or the couch. This may feel a little bit strange, but it'll make the examination easier for you and for the doctor or nurse. The chair or couch will have special support for your legs. You'll see the equipment in the room. This is known as a composco. They use this to look at your cervix more closely. When you're ready, the doctor will circumspect them, like you had in a smear test. This might be a bit cold. Once the doctor inverted the speculum, they will have a look at your cervix. The nurse and the healthcare assistant will be there to keep talking to you and explain what is going on. Once the doctor can see your cervix, they will use some cotton wool to paint your cervix with a special dye called iodine. This will help to see your cervix more clearly. At this point, the examination might be over and you can be dressed and go home. Or the doctor might ask you if they can take a small sample, called a biopsy. This will be very quick. The doctor will use a special equipment called forceps, which take a very small sample from the cervix. It might be a bit uncomfortable and cause some cramps, similar to period pain. This should settle quickly. You might then have some bleeding for a couple of weeks. The clinic team will explain what to do and what to look out for. The doctor will write you with the results. If you're coming for a colposcopy treatment, you might want to watch the colposcopy treatment video.
Getting your results.
Once you have been seen in colposcopy clinic, you will either be discharged, asked to come back for another appointment, or asked to wait for some results. Please do not worry. If you are worried or have any questions, you can get help from your carers or contact your local learning disability team or visit Joe's Cervical Cancer Trust website, joes.org.uk/get-support/helpline.
I'm a learning disability nurse. We have learning disability nurses in the community and in the hospital. My job is to support you and enable reasonable adjustments within healthcare. I will speak to you and find out what you would like me to do to make sure your appointment or stay goes smoothly. There will be a nurse like me in all hospitals. If you have an appointment or need to stay in hospital, please ask for the learning disability nurse.